Hello, this is Andrew Case here, Clinical Assistant Professor at Canisius College Physician Assistant Program. In this video, we are going to focus on having the student work up a standardized patient for a problem-oriented visit, or also known as a sick visit. So it's a more concise interview and physical exam to work up what the patient has come in for. So as the student comes in, the student will introduce him or herself, wash the hands, check the patient's name, make sure that the patient's name is correct, the date of birth, and the identifying patient data to make sure that's correct. The student will also check with the patient and make sure that the student knows what to call the patient. So if it's Mrs. Mary Jones, the student can say, would you like me to call you Mary or Mrs. Jones? At that point, the student will sit down just to have a comfortable, relaxed environment and begin the interview. The student will ask the standardized patient, what brings you in today? That reveals the chief complaint. That's central to the beginning of the interview. What brings you in today? The standardized patient will state what is the problem. So it could be something like, oh, my belly hurts, or I have this wicked headache and it won't go away. Okay, that should be established and documented by the student, and also the standardized patient should have an opportunity to state exactly what is the problem. From there, the student will say, okay, I'm going to ask you a series of questions about what brought you in today. So you stated that you have a bad headache. So I'm going to ask you about what the headache's all about, okay? And at this moment, the student is developing a narrative called the history of present illness, okay? And in the history of the present illness, the student will ask the standardized patients a series of questions that follow a framework in an organizational scheme called Cold or Fast. Cold or Fast is a mnemonic that stands for, the C in Cold or Fast is for character, the O is for onset, the L is for location, the D is for duration, the E is for exacerbation, the R is for radiation or radiating pain, the F is for frequency, the A, there are two, one is for alleviating, and the other one's for aggravating, and then the SR is for severity, scale of 1 to 10, how bad is your headache, 1 being very minimal, 10 being horrible or severe. And then the T is often for temperature if there's perhaps a fever going on. So Cold or Fast is executed. For instance, can you tell me the character of your headache? Is it, can you describe what your headache is all about? Try to avoid leading questions. Try to allow the patient to describe the headache. So the standardized patient may say, oh, it really hurts on one side, it's throbbing, it won't go away, it's burst with light, those kinds of things. The standardized patient will also, the student will ask, well, when did it start? Can you just start a day ago or 2 days ago? The standardized patient will have opportunity to provide an opportunity to say, oh yeah, it started about yesterday morning and just wouldn't quit. Location, again, where does it, is the headache, is it diffuse all around, or is it one central area? Standardized patient will have an opportunity to describe that. D is duration. Is it throughout? Is it nonstop? Persistent? E is exacerbation. Is there anything that makes it worse or makes it more intensified, such as maybe bending over, or loud noises, or bright lights? And the standardized patient will respond to that. R, radiating pain, anything where it's traveling or perhaps causing problems in other areas besides just in that one localized area. Frequency is, again, sort of like duration, but do you have any episodes where it gets worse or it perhaps calms down? What is the frequency of the headache and its intensity? What alleviates it for A, again, when you lie down, or if you take some Tylenol or Motrin, anything that alleviates. Again, what aggravates it, perhaps bending over or anything environmentally that make it worse. S is the measurement of how bad it is, 1 to 10, 1 being minor, 10 being severe. The patient will have an opportunity to describe. It might be an 8 out of 10. And then, is there any fever associated? Have you been running a temp for T? And the standardized patient can say, well, I don't feel feverish, I haven't taken my temp. Or they may feel feverish and they have taken the temp. The student will ask, what was your temperature? Okay? So that helps develop the HPI, the history of present illness, based on that mnemonic, to really get a good feel for the headache. Additional questions that speak to a headache, the standardized patient may respond to questions that are, did you have any trauma to your head? Did you hit your head? Did you have any loss of consciousness if you did hit your head? Have you noticed, again, anything that speaks to a cold or a fever, anybody else in the house that may be sick or who you work with? All right. Have you been exposed to any type of fumes or gases or noxious odors or anything that perhaps has made this headache develop? Additional questions to help develop the HPI are pertinent. Okay. Moving on from the HPI, the student will ask about anything that speaks to travel history. Have you been anywhere that has been out of the area, regionally, statewide, or out of the country, just to see if there's been any exposure? Are you on any medications? Or do you have any allergies to medications? And then go into review of systems. So the review of systems quickly that speak to any potential areas that might be contributory to the headache, such as, do you have any problems with breathing or any cough associated, any problems with your stomach, any problems with your bowel movements, any chest pain, any musculoskeletal pain of any sort? Do you have any things where you feel fatigued or your energy is low? Things that can be consistent perhaps or in conjunction with the headache, okay? And at that point, the student will say, I'm going to just take a look at you and conduct a physical exam, check the vitals, explain the vitals to the patient, and say, your vitals seem okay. I don't know anything that's showing any abnormal blood pressure, temperature, pulse, or respirations. The student will again start the examination by determining any level of distress. Sometimes people with headache, with severe headache, they may show moderate distress where it's just a pounding headache, put their hands in their head and just say this is just really hard to deal with because the light is bothering it. So appreciate any signs of distress with the headache, and then focus on the HE&T exam. The student can palpate the areas of the head to see if they can produce any type of pain with palpation, okay? Appreciate any change in skin color, any signs of trauma to the head. Going back to palpation, the student will palpate the frontal sinuses, the maxillary sinuses, the ethmoids. Again, feel for any discomfort or tenderness upon palpation of the head. Student will do a quick eye exam, determine visual acuity and any response to light to see if there's any pain associated with light. Do a quick extraocular movement of the eyes to see if there's any problems that makes the headache worse. Then the student will do a quick neuro assessment to determine if there's anything that contributes to dizziness or perhaps any signs of neurologic components. So a neuro exam would be quickly executed. At that point, the student will ask the patient, are you okay? Is there anything that you have to add to your symptoms of headache? Based on the history and the physical, the student will say, it appears as though that your headache is related to whatever the cause may be. It could be tension headache, it could be a cluster headache, it could be a migraine headache, it could be some type of common cold associated headache. And at that point, the student will describe what the working diagnosis is most likely to be based on the history and physical, and offer the patient information that speaks to the cause and the degree of complication with the headache. If it's a If it's a headache that's related to a cold, the student will say, it appears as though, you know, you've been exposed to something that speaks more to a common viral type of issue. Or if there's something that speaks to migraine, the student will explain to the patient the cause and the treatment and what should be done for the particular type of headache. The standardized patient will ask questions, and perhaps for any clarity, the student will respond and review the information and complete the visit. If there's any treatment that needs to be provided, the student will say to the patient what is recommended, such as over-the-counter Tylenol or Motrin. If it is something like a migrainous type of headache, there's other medications that can be prescribed, like Fioricet as well, or Imitrex. Okay, that last video spoke to a focus problem, a very common problem, headache. There will be other videos that speak to other common problems that involve other areas of the body, such as the cardiac system, where someone may present with chest pain or shortness of breath. The pulmonary system, it could be cough or wheezes, that is very common, that needs to be worked up, or belly pain or abdominal bloating that has to be worked up as a focused common problem. These are scenarios that you will be equipped with and learn how to respond to questions that are produced from the student, and we will cover that for you.